President, you just reiterated that you hope to have the country reopened by Easter. You said earlier you would like to see churches packed on that day. My question is, you have two doctors on stage with you. Have either of them told you that's a realistic timeline?
I think we're looking at a timeline. We're discussing it. We had a very good meeting today. If you add it all up, that's probably 9 days plus another 2.5 weeks. It's a period of time that's longer than the original 2 weeks. So we're going to look at it. We'll only do it if it's good, and maybe we do sections of the country. We do large sections of the country. That could be too. But we're very much in touch with Tony and with Deborah on everything we're doing.
Who suggested
I
that
just thought it was a beautiful time. To be a beautiful time, a beautiful timeline.
So that was
It's a
based
great
on
day.
any of the data?
It was based on a certain level of weeks from the time we started, and it happened to arrive. Actually, we were thinking in terms of sooner. I'd love to see it come even sooner, but I just think it would be a beautiful timeline. John?
Mr. President, if you look at what we've just seen in the last day or so, you've seen the number of known coronavirus cases in the country double in just 2 days. Another 95 people have died just in the last 24 hours. New York's governor is saying this is spreading like a bullet train across the country, and the governor of Louisiana is saying that his state may not be able to handle the cases that they're facing by early April. So what are you seeing in all of this that leads you to think that we could reopen by Easter or even earlier?
Sure. We're working with all of them. We can be talking about large sections of our country because there are sections of our country that you didn't talk about that are doing unbelievably well. They have very little incidence or problem, very small numbers. It's very possible that they won't be ever subject to what's happening in New York. New York is definitely a hot spot. There's no question about it. And you know what we're doing in New York to try and help. And I think we're doing an incredible job. We're going to have the hospitals up quickly, the medical centers also quickly. But we'll just have to see. We have to follow it. We have to see. We're going to look at that curve. We're going to see when it starts coming down. And we'll do the best job that can be done. John, please.
Question for you, Mr. President, Dr. Fauci, if we could. Just looking at this idea of an Easter timeline, and I don't know that's probably flexible, what are the metrics by which you will make the decision as to whether you can say, yes, we can open up this area of the country, or no, we can't open up that area? I mean, will you be looking at disease numbers? Will you be looking at possible containment, isolation?
I think we'll be looking at a lot of things. We'll also be looking again at very large portions of our country, and I will be guided very much by Dr. Fauci and by Deborah and by some of the other professionals that work with both of you, and we're going to see what will be. But that would certainly be, I think that's a goal that perhaps can happen, or at least for a very large portion of our country.
Dr. Fauci, since, as the President said, you and Dr. Birx and others will be guiding him in making the decision, where are you now with this timeline of 19 days from now?
So, I mean, that's really very flexible. We just had a conversation with the President in the Oval Office talking about, you can look at a date, but you got to be very flexible. And on a literally day-by-day and week-by-week basis, you need to evaluate the feasibility of what you're trying to do. And, John, you asked for, what kind of metrics, what kind of data. When you look at the country, I mean, obviously, no one is going to want to tone down things when you see what's going on in a place like New York City. I mean that's just, good public health practice and common sense. But the country is a big country, and there are areas of the country, and I refer to this in my opening remarks, that we really need to know more about what the penetrance is there. So if we do the kind of testing what we're doing, and testing will always be associated by identification, isolation, and contact tracing, and you find after a period of time that there are areas that are very different from other areas of the country, you may not want to essentially treat it as just one force for the entire country, but look at flexibility in different areas. So I think people might get the misinterpretation, you're just going to lift everything up, and even somebody's going like that. That's not going to happen. It's going to be looking at the data. And what we don't have right now that we really do need is we need to know what's going on in those areas of the country where there isn't an obvious outbreak. Is there something underneath the surface that says, wait a minute, you better be careful and really clamp down? Or what looks there that you don't really have to be as harsh as you are in other areas. So it's looking at information that up to this point, John, we never had. So it's a flexible situation.
So is New York becoming on? Is New York becoming the epicenter?
Well, it certainly is by far the, if you call it hot, if you call it any word you want to use, it is at a level that I was speaking to Tony before. It's a level that no place else is close. It's very unfortunate. You know, one of the things that's happened that we've done, I think, a really good job on. I think that it's something special. What's happened is I learned from Dr. Birx a little while ago when she said, I learned it actually this afternoon, in 8 days, because we kept hearing about South Korea. They had a very tough time at the beginning, if you remember. In 8 days, we're doing more testing than they've done in 8 weeks. That's a tremendous turn. And with our testing, it's going exponentially. It's going up, up, up every day. So we're going to be able to do things with this very highly sophisticated testing. And it's also, the test itself is considered the best test. So on top of doing now more than anybody else, we have a very high-quality test. That makes a big difference. It also makes a big difference even in terms of opening, because we're going to see those areas like the hot spots. But New York City definitely is a very hot spot. Steve?
When you talk about areas that you could open up, what specifically are you looking at? What states? Are you talking about out west?
Well, you can talk about
Where
the Farm Belt. Take a look at the Farm Belt. Take a look at areas out west. Look at big sections of Texas. I was talking to the great governor of Texas. They've done a fantastic job out there, but they have very big sections of Texas where, you know, it's like numerous states, frankly. But we can have large sections of, if we want to do it that way, we can have large sections of the country open. I think it's very important that we start moving on that and start thinking about it, because our country wants to be open. Our people want it to be open, and they're raring to go. And I think it's one of the reasons that we're going to have a tremendous bounce back. I think it's going to go very quickly. Also, I want to thank, while I'm here, I want to thank Larry for the job he's done, Steve Mnuchin for the job he's done. If you look at Peter Navarro, he's sort of doing different things. He's really, he's a force in terms of getting masks and getting all of the ventilators and all the things. He's been fantastic, Peter. But I also want to thank Congress, because whether or not we're happy that they haven't quite gotten there yet, they have been working long hours. I'm talking Republicans and Democrats, all of them. The House, the Senate. I want to thank Congress because they are really trying to get there, and I think they will. And I'll see you all tomorrow. Thank you very much.
Did you give Governor Cuomo a heads up, Mr. President, about the quarantining for people who left New York? Did you give Governor Cuomo a heads up about quarantining people?
We're talking to them.